Hey, Monique.
Hey.
How you doing today?
Fabulous.
Are you so excited for our conversation?
Totally. I'm here for it.
So, as you've been listening along, we've been doing a series on Monique's breast cancer diagnosis and her journey. And at the beginning of deciding to talk about this on the podcast, we were really clear that if you could have your surgeon, who you are just
obsessed with
on the pod, that we would try to have that.
Yes.
You guys, she's here today.
I know. We're very, very lucky.
So exciting. So on today's episode, we're going to have a really amazing conversation, a candid, helpful, incredible conversation with Dr. Jen Witt of the Minnesota, a breast surgeon with Minnesota Oncology, joining us here. And listen up, if you are a woman, if you know women, anything to do with breast or breast cancer, you're going to want to listen to this episode. Let's go. Welcome to Heart and Soul, the podcast where we empower and inspire women to lead their best lives, harnessing the power of their hearts and souls. We are Mariah
and Monique,
your hosts and guides on this journey of self-discovery and personal growth.
In each episode, we will dive deep into topics that matter most to you, from self-love and confidence to career development, relationships, and everything in between. We believe that every woman has a unique strength and inner wisdom waiting to be unleashed.
Join us as we cover insightful heart and soul-centered topics and interview incredible women who've overcome challenges, chased their dreams, and found their true purpose. Through all of this, you will discover practical tips, strategies, and real-life stories to help you navigate life's twists and turns.
For whatever season of life you're in, this podcast is your safe space to explore, learn, grow, and possibly even laugh and cry with us. So grab your headphones, maybe your favorite drink, and we'll embark on this transformative journey together.
With heart, I'm Mariah.
And with soul, I'm Monique.
Well, I want to personally welcome Dr. Jen Witt to the podcast today. Thank you for what you have done to help my dearest friend, Monique. I know she's so happy to have you here today. So welcome, and I'm excited to dive into this episode. So Monique, do you want to share your story?
Yeah, a little bit. I'll just catch everybody up. So we've been talking the last couple episodes about my journey with my breast cancer diagnosis and my treatment and how that's been going. And we also interviewed my naturopath oncologist and got her perspective on cancer treatments. And I absolutely wanted Dr. Jen Witt here today because she was an integral part of my treatment. I had surgery scheduled with another surgeon, and it's nothing against the other surgeon. It's a general surgeon. I just didn't feel comfortable. I felt like I was just being put into the, like on the hamster wheel, or like, this is what we're going to do. You have this, we're going to do this, and then we'll do this and this and this. And it was just like, which is fine. I think for a lot of people, that's probably fine. Apparently, I'm an overthinker, and that wasn't fine. So
no, you just knew that you needed to make a choice for yourself about exactly who was going to treat you.
Yes.
And you had options.
Yes. But because you feel so rushed, because you hear cancer and like tumors grow and you're like, oh crap, I got to make this decision ASAP. You kind of just go with the flow.
Yep.
But then there's a large part of me who's like, why are we going with the flow on this? We don't really go with the flow with much.
Mm-hmm.
We kind of like direct our own way. So maybe we should ask more questions. And so I had surgery scheduled.
Yep.
As I think we talked about before, you kind of had a call out. You were like, you're not ready.
I had a sense. I had a sense that like you just didn't feel settled with this
path.
Yes.
Like,
again, you were like, well, there's nothing against the surgeon, but like, I just knew you weren't settled with it. And I knew that you had options and that you needed to explore them. And I think I point blank asked you, is there a rush? Like, how many weeks do you have before this gets worse? Like, and you kind of paused and went, I don't even know.
Yeah.
And it was actually, ironically, right after that, the surgeon
Called
you
Yeah.
to talk about the next day, and you
Yeah.
asked him that question. I was sitting right there, and he said, "Oh, you have some time," and we were both like, "Take the time,
Yeah. Cancel.
cancel, figure this out." Because when you know that you're in the right hands, you'll know.
Yes.
And that's exactly
Yes.
what happened.
Yes. So regardless, I found my way to Dr. Witt. She got me in the next day after. I mean, it was phenomenal. I think the day I had heard about you, someone referred, your office or your nurse called me and you got me in the next day. And I know you're busy. You're a busy lady.
Amazing.
So while the first one felt really push-pull, the first appointment, the first surgery, this one felt like, wow, I'm in the flow of being taken care of.
Yeah.
It felt really, really nice. So then I met you, and I don't even know how long your appointments are supposed to be, but I feel like I was there for like 2.5 hours. It was pretty amazing. You took the time. You explained everything in detail. You answered my questions, which I have so many questions because I'm a life coach, and that's like basically what we do is we ask questions. And so I just left there and I was like, oh, so I met my surgeon. She's amazing. And before that, I had not even like really gotten comfortable with having surgery, right?
Right.
So, I just can't say enough good things about you. And also your surgery skills. I've had surgeries before. Your surgery skills with how we heal, how the scars present, how the tissue presents, next level. I mean, just goddess style over here. But I don't know if that's a good enough introductory, but
yeah. Well, everything changed in your journey as soon as I mean, she called me like the next day and was like, I found my surgeon. I'm feeling at ease with the decision.
Yes.
Now I'm prepared for the procedure. Like your anxiety just
It dropped.
It dropped, and it was like, okay, this is clearly the flow of the next step, and has been basically that way ever since.
And I've given Dr. Witt permission to speak about my case over the podcast because I want to use myself as a way for other people. I've always said this through my life, which is really interesting. Maybe I should stop saying it so I stop having to learn.
Yeah, right.
Is that if one person can learn from what I have experienced and gone through, then it wouldn't be for naught. Right?
Yeah. That's a perfect segue for us to, they hear our voices all the time.
Yes.
We want to hear from Dr. Witt.
Yes.
So we'd love to hear more about your passion for breast health and all of the amazing information that you can share with women. So
my cheeks are red, first of all. So the first thing I wanted to say is thank you for having me. I really appreciate it. And it's exciting that women in October will hear about your journey and have an opportunity during Breast Cancer Awareness Month to, have some more information. I want to say that I truly think that it is a gift to get to be a part of your care, and that going through this experience and walking women through it and making it as easy as it can possibly be is something that I value and I feel like is a gift. So thanks for having me, and thanks for letting me be part of your team. It is an honor to get to be. To speak to some of the things that you mentioned, so I started my career as a general surgeon doing a broad spectrum of all general surgery care, and that is where most breast surgery happens, is in that realm. It's an overwhelming field because there are new recommendations and updates and progress made every 6 months, for the treatment of breast cancer, management of breast cancer, that actually go into taking care of patients, that actually go into clinical practice. There's not many things in medicine that change that frequently, or that we have updates that frequently. And it was really overwhelming for me to stay on top of that, to try to do everything well. I love taking care of women. I love taking care of women with breast problems. I love trying to make that experience easier. And so it was a no-brainer for me to sort of narrow my practice. And now I focus exclusively on breast problems, breast care, breast cancer, which is what I'm super grateful that I have an opportunity to do that. And that Minnesota Oncology lets that happen and has an opportunity for that. So the surgeries are going to be really similar, one way or the other. However, there are different approaches, different caveats that I think when you have that as your focus, you're able to spend more time, not only with patients and with their journey and offer a whole bunch of other different resources for them, but also in the progression of how we take care of women. So the things that have happened in the surgical forefront are, we used to approach breast cancer as just get it out and get it out with good margins and make 100% certain that they have an excellent cancer operation. We now have progressed and have an opportunity to get it out, make sure they have an excellent cancer operation, but also have considerations for how is this going to look cosmetically when all is said and done. Yeah. And the intention of that, it's called oncoplastics, and the intention of oncoplastics is to completely separate you from this disease, to remove it from your body, but give you an outcome that doesn't make you think about your breast cancer diagnosis every single time that you get dressed moving forward for the rest of your life, right?
It's amazing. Yeah. I mean, I almost wish I could show people, but I can't.
I've seen it. It's amazing. I know. But I never heard that term oncoplastics. And you always are in, my past things I've heard or seen about this, it's like the surgery, get it out, and then figure out if you're able to reconstruct or do anything after. But if you have your care team aligned and you're working with the right people, you can do a lot of this in the one surgery.
Absolutely.
And that feels like huge. Like, why wouldn't you want to do that? And if you have the opportunity to work with a specialist, absolutely.
Yeah. Yeah. It's really fun to get to think, how could I hide this incision? How could I approach this cancer in a way that is, that will have a great outcome, but will have a great outcome from all different aspects, So that part's really exciting.
That's your art.
Super fun. Yeah, it is. Yeah. Yeah. So it's super fun. The other advances that we've advanced substantially in how we care for breast cancer and achieved better and better outcomes with respect to breast cancer. Our next forefront is, how can we help prevent it? How can we diagnose it as early as we can possibly diagnose it? And is there an opportunity for how we could actually prevent women from developing breast cancer? And that's where we're headed kind of next. So.
Yeah. Is that more using the science behind? Yeah.
Yeah. The first step is to identify the women who genuinely have an elevated risk for developing breast cancer.
Okay.
So we use information about you, your body, your life, your exposures in your lifetime. What have your breast cells seen in your lifetime? And we pair that with your family history. What potential genetic components could you have inherited that increase your likelihood for developing a breast cancer in your lifetime? And then we pair that with your breast composition. How dense is your breast tissue? And so they just passed a law that they have to tell you your breast density on mammograms. So that was out there. People may have heard about that.
Yeah.
Yep. And that's because if you have extremely dense breast tissue or heterogeneously dense breast tissue, you sometimes cannot see small tumors that are developing. And so if you have a elevated lifetime risk for developing breast cancer, if you are a high-risk person for developing breast cancer because of various factors in your life, and we can't see it well on mammogram, then we should add in additional imaging just for screening purposes to try to identify those breast cancers as early as we possibly can. And if we know that you have a markedly elevated risk for developing breast cancer in your lifetime, there are just lifestyle modifications that you can employ. There are huge substantial benefits from different types of exercise and movement. There are just simple things like that. There are medications that you can use to help decrease your risk of developing breast cancer. And if you're someone who has a genetic predisposition that puts you at a really high risk for developing breast cancer, we will preventatively remove your breast before any cells can change to a cancer cell or precancerous cell.
Yeah, it's a lot of options, which is great. So how does one person go about finding out some of that information, right? Like, how do you find out if you're at risk? And also, if this is cutting edge, how many doctors are out there, that you can find to even help you with this?
Yeah, great
right?
question.
Yeah.
I think it's so hard and so challenging. We're asking more and more of our primary care providers and our OBGYNs and our doctors that take care of women.
Yes.
And then to ask them to do one additional thing and utilize this risk calculator, which takes like 20 minutes to put all of this data into this calculator.
Wow.
And ask them to be doing these calculators, I think some of them are amazing and get it done. And I think it's challenging to add something else into that
For sure.
annual visit. Yeah. So there are high-risk programs. So there are programs that have dedicated professionals to calculate that risk, look at your tissue, make some recommendations about how well we can see things, then do a breast exam and help you follow your tissue and help you make some recommendations for how to decrease your lifetime risk. You can also calculate your risk online.
Oh.
And so
that's interesting.
You could even do it yourself.
You can totally do it yourself. So it's called Tyrer-Cuzick is the little risk model that is the most comprehensive.
Okay.
You can host a girlfriend party. Everybody can calculate their lifetime risk.
We're doing it.
And once you calculate your lifetime risk, then you can figure out, are you in a category where you're elevated or not?
Okay.
Then because law mandates that they have to tell you how dense your breast tissue is, you can look at your mammogram report, see how dense your breast tissue is, and understand if you would benefit from any additional screening or not. So you can kind of advocate for yourself, or you can go to one of the established programs and have them do it for you. Either way.
Okay.
That's so huge.
That is.
My mind is blown. Like, seriously, because my whole thing in your journey and what I've just been like really coming to realize as a woman in today's medical landscape is you have to advocate for yourself.
Oh my gosh.
And you said exactly those words. And in the fact that there are tools out there where not only can you advocate for yourself, but you can do some of the legwork for yourself, which like being able to do that and then go into your primary care provider or your OBGYN and say, hey, I have all of this. I've done all of this for you. You just need to get me to the next step.
Yep.
Like your likelihood of that happening is gonna increase dramatically, and you can't let go. You have to, like, especially if you have a knowing, if you've got something, just telling you like I have a knowing here, you have to, having those tools, you have to advocate for yourself.
Absolutely. I always say your patient is your best diagnostic tool, right? If
Yes.
you identify something that's abnormal on your exam, or you feel like there's something that isn't right, you know your body better than we do.
You have to listen to that,
Absolutely.
right? Because we're living in it.
Yeah.
And that, like you said, if something's different, if you detect something has changed, only you can do that because you have the measure of what it
normal
was
is.
before,
right.
what normal looked like.
Yeah, you live every day in your body.
Yeah.
Absolutely.
So we'll have to link that into the show notes so people then can have a girlfriend party
Yes.
and do that, because that's taking back your power.
Absolutely.
Which this whole thing did leave me feeling a little powerless until I met you, until I met my naturopath oncologist. I was like, thank God there are these people out here who don't just put me on the hamster wheel and just like, So anyways, what age do you think, though? We had a little bit of a conversation, like you have been doing some work outside of the US too, where you were telling me you were kind of surprised that, because you're talking about the terrain, the environmental factors, where you go to areas where environmental factors are not a thing. So what age do people need to be doing mammograms or screenings? And then also, tell us a little bit more about that.
Yeah. And so that score will help you know that.
Okay.
So we are absolutely seeing a rise in young women with breast cancer, which is terrifying.
Yes.
And I, in my like little nerdy scientific mind, have thought that there has to be something that we're exposed to or something that we're doing that is increasing that risk for for younger women. But where I outreach in Honduras and do some international medicine and breast cancer work there, these women live in a very rural environment. They live very, very different lives and have very different exposures. And I'm seeing the same trend there with young women with breast cancer.
Interesting.
So interesting, right? Like, what is
going on?
That's got to really
Right.
get your mind rolling.
Yeah, absolutely.
Yes.
And so if we know that you have a genetic, if we identify a gene and, you know, my high-risk clinic and we can send genetic testing right that day, right? If you want to do genetic testing right that day. So if you have a known or an identified gene that puts you at an increased risk for breast cancer, we actually start imaging we start recommending imaging at approximately age 25.
Oh, wow.
Wow. 10 years earlier than the first diagnosis in your family, if you have a strong family history without a known gene, is usually the recommendation.
Interesting. See, if I would have known that, because my aunt passed away, my dad's sister, of breast cancer, and she got it young. So, I mean, didn't even know that.
Yeah.
That fact alone, like people listening, think about that. Women in your life and in your family, genetically attached to you, that have had breast cancer, how old were they?
Right.
And then measuring yourself against that. And how close of a relationship is it? Is it your mother?
Yeah.
Is it your aunt, your grandmother?
Right.
Yeah.
I'm thinking about that.
Yeah.
But then, well, I'll let you answer that and then kind of put yourself then in what does your care look like?
Yeah. So I think it's a really, really different piece of information to say, well, I have no family history of breast cancer.
Right.
But you don't actually have any women in your family, right? Like I don't have any sisters. I don't have a maternal aunt. I don't have any, right? So that's a really different piece of information. And then you have to start looking at, well, were there men with prostate cancer?
Okay.
Well, were there with
Other
anybody
cancers.
with ovarian cancer? Because those genes are related to those tissue types as well.
So it's broader than just breast cancer.
Yeah.
And taking like just your general family cancer
Yeah.
history and seeing where it shows up there.
Yep. The National Comprehensive Cancer Network is a coalition of experts whose only job is to be constantly reviewing the literature for breast cancer and making recommendations. And they recommend if you have any male in your family with a history of breast cancer, if you have anybody in your family with a history of ovarian cancer, then you should consider genetic testing.
Yep.
If you have multiple first-degree relatives, so moms, sisters, even maternal aunts from that same lineage, then you should consider genetic testing. If you have atypia or abnormal cells in your breast at an early age, you could consider it. And if someone in your family is diagnosed with a specific biology of breast cancer, so there's hormone receptor positive breast cancer and hormone receptor negative breast cancer. Our breast tissue is normally stimulated by hormone, right? If you think about how your breasts change with your period or with a pregnancy.
Yep.
So our cells are used to being stimulated by hormone in our breast, and they divide and grow when stimulated by hormone. The hormone receptor negative breast cancers are sort of disobeying the laws of nature.
Oh, interesting.
They're growing without even being stimulated by hormone. And so that biology of disease is more likely to be related to a genetic problem than it is to be. So the biology of the breast cancer that women have had in your family also play a role. Yeah.
How does somebody, so say myself, like, how do I go about getting the genetic testing? Do I start by just going to my primary care physician and asking for it? Tell me about what you'd recommend for somebody like myself.
Yeah. So if you are concerned that you may be somebody that would benefit from genetic testing, you can either go find a genetic counselor.
Okay.
There is we need more genetic counselors. Recommend everybody going into genetic counseling. So we need more genetic counselors. So because of that, there are other providers that have said, I want to do the additional training. I want to understand who are the people that would benefit from genetic testing. I want to understand which are the genes that we should test for and how should we counsel people, because getting genetic testing can be a little scary.
Yeah.
Like this does not mean you will develop this in your lifetime.
Right. You don't want to take the information the wrong way.
Yeah.
Yep.
So we want to make sure we support you in that journey of additional knowledge as well, right? So you can go to any of those providers and have genetic testing done too. So most high-risk breast programs will have the capacity to be able to send genetic testing. Some breast surgeons will have the ability to be able to send genetic testing, and most oncologists will be able to do genetic testing as well.
Who ordered mine was my oncologist. Yeah. And my tests came back negative for genetics. Mine were all hormone induced.
Oh, okay.
Yeah.
Yep.
Mm-hmm.
Interesting.
Mm-hmm.
And it's something, I mean, just a blood test, right?
Yep.
Like a
Well,
simple.
it's actually saliva.
Saliva.
and blood.
Yeah, it's
Saliva.
easy.
Mhm.
It-
So
So easy.
so speaking back to waiting for your consults,
Yeah.
I will never make someone wait. I do not want you
Oh.
to wait with a new diagnosis of breast cancer. I do not want you up at 2:00 in the morning Googling. I do not want you to do that.
Yes.
So I will do sometimes televisits
Yep.
where I can't see you in person until after the weekend, let's meet and have a televisit on a Friday and just answer all the questions and talk through some of the things. And then I will see you and do your exam, that next week. If I do one of those visits and a woman is a candidate for genetic testing, we drop ship a genetic testing kit to her door and she can do a saliva test.
No way.
Yep.
I mean, amazing.
Yeah.
And so, I mean, then so much information that you can glean
Mhm.
from those results
Yep.
to help guide,
Yes.
you
And
know.
then your journey has started.
Yes.
The hardest part about hearing you have breast cancer is that you don't have all the pieces of information and you
Mhm.
don't have your plan laid out in front of you. And all of those additional pieces of information take time to
Yes.
do the testing, to have the
And you
results.
have to go through the surgery before you
Yeah.
even know like what
a
your
whole bunch of stuff.
staging is.
Right.
Yeah.
Right.
see
So
if it's
there's
spread.
the
Yeah.
genetic piece, but then there's the testing of the actual tissue that
Yeah.
happens after the surgery.
Mhm.
Yeah.
So talk about a little we were visiting before the podcast about the algorithm and
Yeah.
how like when Monique first, went to the surgeon, they're like, here's the course, right? Here's the like you do this, 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 and this based on
Yeah.
you set an algorithm.
Yeah.
Share a little bit about what that looks like.
Yeah. More dollars going into breast cancer research than any other type of cancer research.
Wow.
Which is incredible.
great.
That is.
It's amazing. And it means we actually make progress. So there is this mounting mass of information about different trials that are closing, additional new information. There's this piece of data, that piece of data, and it can be really difficult to figure it all out and put it into practice.
Mhm.
So the National Comprehensive Cancer Network, coalition of experts that is constantly reviewing all of that data that is coming back in, reviewing it in a multidisciplinary panel, and then deciding what is ready for prime time. What
Okay.
should we actually implement right now? This is a practice-changing test. This is
Wow.
really great data.
They're moving the needle.
They are.
Yeah.
100%. And so they publish for all the other providers taking care of women with breast cancer. Here is the current recommendations for, September of 2024.
Right.
Here's the current recommendations for how we should treat. And then each cancer is different. So for hormone receptor positive cancer, for hormone receptor negative cancer, for HER2 positive breast
Mhm.
cancer, these are the recommendations
Mhm.
based on tumor size, based on whether or not it's contained within the breast, or if there's a chance that it's not contained within the breast. This is how we should approach it. And so whether you're getting your care at Memorial Sloan Kettering or MD Anderson or Mayo or Minnesota Oncology, wherever you're getting your care, the algorithm is likely going to be the same. It's up to the providers to see the individual patient, to provide all of the information, but really truly individualize care and support what makes the very most sense for you and your whole being,
Right.
not just what makes sense for your
Right.
breast and your biology. Right?
And so much so, like when I came to see you, I said, I'm really anxious. Can I get some Valium before the surgery? And you told me yes, because the studies have shown that the calmer you are, the more information you have before your surgery, like the better the results after the fact, which I found fascinating. But of course, right? Can you explain that just a little bit?
Absolutely.
Yeah.
So fight or flight releases cortisol. Cortisol is an immunosuppressant. Our immune system's job is to get rid of bad things in our body, right?
Yeah.
So the more you impair your immune system,
Mm.
the less well it will work. And there's studies that show that the higher your cortisol level is around the time of your surgery, around the time of your treatment, there is a slightly increased risk for recurrence.
Mm.
And the only presumption can be, well, that may very well be because we're impairing the immune system.
Yeah.
So I try to have all of the hard conversations before the day of surgery, right?
Yeah.
I
No
try-
surprises.
I want it to be as easy and of a day as possible.
It's almost like boring. You want to show up and have it be like boring.
Yep.
No drama.
I've already
No
told you all
drama.
the things.
Mhm.
You know, these are all the things that can happen. This is how the day is going to go, and let's try to make it as smooth as possible. And creating a team and an environment that can do that is incredibly important, I think.
Yes. And your team totally did that for me. I remember just feeling like, wow, I just feel so taken care of. They gave me all the warm little things, the little, I don't even know what they're called, but hot, you know, I was warm. They were like, would you like that? I'm like, oh, I could get used to this.
I can get used to this.
I mean, not really, but
Yeah, basically
it was
spa
really,
day.
yeah. Well.
as best we can make it. Sorry.
But that says so much, and I love that way that you're thinking about the whole being. And you've said that a couple times. Like, I also just when you said that you don't want someone to have to wait, and to be Googling at 2 a.m, and to be inducing even more cortisol into their body at the exact time when they don't need that, right? Because the anxiety around what does this mean for me, and not being able to predict their future.
Yep.
I just think that, like, kudos to you for aligning your practice to even make that possible to meet with people so quickly.
Yeah.
Yes.
I mean, that cannot be easy. And the importance of it, it's like, wow.
Yeah.
It's just mind-blowing.
I have an absolutely incredible nurse, Amanda Buck. She has been with me. We've worked together for many years, and she has a wealth of knowledge, is absolutely incredible. And when I'm in the operating room and not available, she's available.
Yeah.
You know, so she's able to call patients right away, get patients in right away, answer any questions that you may have that are just burning questions that cannot wait, you know, and she's an invaluable part of the team, invaluable resource for patients.
Like you said, it's your whole team. It's the way that you have cultivated a whole team around this care so that everybody's aligned on how to get the best outcomes.
Yes.
Well, so one thing that we talked about from the beginning too is wanting this to be a platform for anybody listening to, you know, learn the most they can about what to do if they feel they might be a candidate for genetic testing, if they have a diagnosis. So I'd love to just like give you the floor to share, like, what do you want people to know more than anything?
Yeah. I see women all the time who haven't come for months because they were scared. And I don't want women to be scared.
Yeah.
I want you to know that you have many options, and that the sooner you come in, the better. So do not be scared. If you have something that has changed in your breast, come in, and we will chaperone you, escort you, protect you through the procedure, through the process. And so having breast awareness, understanding if something has changed in your breast, if something has changed in your body, letting us know so that we have a chance to figure it out and to find it and to identify it as early as possible. I think I would love for us to be able to identify more women that are truly high risk, to identify those women before they develop any disease. So having your girlfriend party.
I love it.
Considering whether or not you are a candidate for genetic testing, considering whether or not there is any additional screening that we can do. Olivia Munn is an actress who was just diagnosed with breast cancer. She had a normal mammogram. Her provider identified that she was high risk. After calculating her score, she had additional imaging with an MRI, and her breast cancer was diagnosed then. She has been very active in social media, getting that message out, trying to have women understand that you may need additional testing. You may be a candidate for genetic testing, and so identifying that early on. And I think those are two separate things: screening or identifying your risk before you develop anything, and then identifying if something has changed, identifying it as soon as possible. So we see a huge uptick in mammograms in October with Breast Cancer Awareness Month.
Good.
Go get your mammogram.
Yes.
Drag your girlfriend with you. Go have mimosas afterwards, whatever you want to do. Or brunch, a lovely brunch afterwards, whatever you want to do. But go get your mammogram if you are due for that. And, if you have any questions, concerns, bring them to your provider, bring them to us.
Yes.
And truly, of all of the tests, it's the least invasive. Like, it's really not a big deal to have a mammogram.
I didn't feel so, but some people I think maybe who have denser tissue find it extremely uncomfortable.
Yeah.
That just wouldn't be me.
But it doesn't last very long. I mean,
No.
really, think about it.
They're so good at it.
Yeah. And, it's typically not that hard to get on the schedule. There's multiple options. It's a no-brainer. is a no-brainer for me.
Yeah.
That as soon as you can go and you, based on your calculation, you know, have the risk factors, just get it done. And then you have a baseline, right? You develop that baseline to work off. So when you have maybe detected a change, or the next time you go, now we have data to look at. We have a history to see if something has changed.
Absolutely.
I mean, why wouldn't we as a society be advocating for that to be happening earlier and earlier?
Yeah.
That's just something that I've been thinking about, as, you know, they tell you, at 40, 45, every 3 years.
Right.
I've challenged my own primary care physician on that and been like, I don't want to wait 3 years.
Yeah, no, for the average risk patient, you should have a mammogram definitely by 40 and every year thereafter.
And that is not what they've been saying.
I know. So
I challenged it.
Yeah, you should have one, absolutely have one every year. If you are truly low risk on your calculation, then you can have a different conversation.
Sure.
Absolutely. But mammogram starting at 40, mammogram every year. And then the question comes, well, when should women stop having their mammograms, right?
Oh, yes.
Right.
Is that a thing?
Yeah, it is a thing.
Okay.
Yep. And so I think you should continue to have your mammograms at a routine basis until you would no longer do something about it if you found something.
Oh, wow.
Oh,
right?
That's a good way to say
Yeah,
it.
wow.
Yeah.
So
okay,
if you have severe heart disease and really
Sure.
probably wouldn't be able to have surgery, if you
Sure.
have severe lung disease and you're on oxygen, if you have other major medical problems that really take precedence over a very early stage breast cancer, and you want to stop your mammogram screening, I think that's reasonable. But I don't think there should be like a cutoff where you're like,
Interesting.
at this age, you no
and
longer
that
do
could be
mammograms.
very late in life.
It could be, yeah.
Because of the advancements in all medicine.
Yes.
That's
Yes.
that's
I
a ways
operated
We're
on
away.
living longer.
Yeah.
I operated
Right.
on a 91-year-old on Monday.
Oh,
No
wow.
way.
You know? So,
Wow.
yeah.
That's fascinating.
Yeah,
That
I
is
know.
amazing.
Yes.
Yeah, that guardrail or that recommendation I feel is very empowering.
Yeah.
Because to go with that information to your own primary care physician, one, ask to do the screening, like ask to do your risk assessment.
Yeah.
Great. Now we have some valuable information to make decisions based off of. Second, and not just a broad recommendation, right? Next, advocate. No, I want to do this every year. It's very little skin off my back to go and spend 30 minutes getting this done.
Yes.
Absolutely.
And then no, I don't need to somehow be worrying about the other end of when's the right age to stop doing it. That
Just keep doing
makes
it.
so much sense. Keep doing it until
Yeah.
exactly you said, that you
you
wouldn't
got
do
other
anything with
things in the way.
information.
Yeah. And it's not to say there aren't primary cares out there who are all over this and know about,
Yeah, of course.
or OBs, or, all of the different providers that we see. Some of them absolutely are, but I just think knowledge is power.
Yeah,
know?
absolutely.
And I think that is like the whole point of this conversation that Monique and I have been having about her own experiences, back to self-advocacy. There's nothing stopping you from advocating from yourself. And if you are in a relationship with a doctor where you hit a dead end with that, that's your first sign to try somebody else.
Yeah, I think there's a feeling of shame or guilt as I can only speak for myself, but I do know that I'm highly relatable as for other people as well. That well, that didn't feel right to me, but they're more educated than I am, or maybe maybe am I being just stubborn or whatever. So you kind of have this internal struggle. But part of me, just with seeking you out and seeking out alternative care, was fuck it. This is my life. I have to be stubborn about this, and I have to if I don't answer these questions, or if I don't follow this path, this thread, in the back of my mind, I'm going to wonder, and and that's not good for care, right? To have all these questions unanswered, or to feel well, I did it because that's what they told me to do. You really self-advocacy is super important for healing, as you mentioned. All of it, but yeah, I just feel we have to kind of get over that shame or guilt and stand up and I understand that that's how you feel, or doctor, person, but I need you to do this for me. And if you can't do this for me, to Mariah's point, I need to find someone who aligns with me, not because I'm a hypochondriac, but because I feel something is off, right?
Yeah. And here's that. And like you said, the patient is your greatest diagnostic
Best
tool,
diagnostic tool. Yep,
right?
absolutely. Yep.
So if they are not responding to that. It
Right.
is okay to see someone else. And in fact, one of the podcasts that I was listening to that I shared with Monique in the beginning of her journey talked about that, how she just had a lot of shame around
Yes.
telling that surgeon, no, I'm not going with you.
Mm-hmm.
When after the fact, looking at, ultimately met with 4 different surgeons and chose one, the prevailing sentiment was that doctor also thinks you should see someone else.
Yeah.
Because they also understand that you need to find the right fit
Yes.
and the right chemistry of relationship. So it's not a shame.
No.
It's just the process that
Right.
would be smart to follow.
But we
100%
somehow
true.
take that on. And I'm not sure why.
Yeah.
So I want to demystify that. Like if you feel that, like you go to your primary physician and you're feeling guilty or shame because you're pushing back and you're not, or they're pushing back on you or whatever, it's okay. Switch.
Yeah.
Yeah.
Or you meet with a general surgeon
Right.
and you feel like, I kind of want a second opinion. I remember my father always raised me like, you got to get a second opinion or a third opinion. And I feel really appreciative of that now because of this story. Right.
Right.
And I said that to you, like, you can get a second opinion. You can meet someone else. Like, again, how much time do you have? This is not emergency. And then look at how that resulted.
I see patients as second opinions all the time. I am never offended that they have seen someone else,
Good.
and I'm never offended with which way they go. There's that algorithm that
Right.
sets up really, this is the recommendation, and whether, no matter who you see, you're probably going to be within that scaffolding of recommendations, right?
Yes.
Unless you're at a center where they're not following NCCN, and that would be worrisome
Yes.
to me.
Yes.
But, within that scaffolding, then it is just finding the right fit for you. We all are different. We all have different personalities. There are some people that sort of need that you're going to do this, and
Yes.
this, and I'm not a good fit for those people because I'm going to give you all of the data and help guide you to make the decision that makes the most sense for you, So it's finding the person that you align with, that you feel the most confident, the most comfortable with, and no surgeon should take offense to that. We are
Right.
used to people getting multiple opinions. That also helps that cortisol level, right? I mean, once you're in the right place and you feel like this, you're in the right situation, then that is then you're in the right spot, and it's going to be a better outcome overall.
Yeah.
I love that. I can totally hear this being like a featured quote of this, like, no surgeon should take offense to that second opinion. And you
Right.
expect that. And like everybody listening, just remember that for whatever, whether it's breast cancer or any other cancer or any other ailment that you're dealing with, like
And you may hear
advocate.
exactly the same thing,
Yeah.
right?
Right.
Then you just have
Then
data to support your decision making.
yeah, then it's just, which personality or
Yeah.
whatever,
Exactly. Whatever will lower your cortisol
Totally,
levels.
100%.
And even talking about that, I'm like, we need to do a whole podcast on lowering cortisol levels.
No kidding.
So
Jeez.
let's go to that now. The idea of what are the risk factors in your life, even beyond your genetic predisposition that you're looking for, that women could be looking at, and how to prevent breast cancer within their lives.
Such an amazing, good question.
Okay.
Thank you. So, oh my gosh, they've studied so many different things that we think could potentially be increasing risk. So every cell in your body divides. It is possible that when a cell divides, it's going to divide with an error. Our cells divide with an error all the time. And it's our immune system's job to identify that cell has divided with an error and get rid of it. If that cell that has an error in it isn't identified, then it can go on to make more and more abnormal cells become even more abnormal, lose its brake and its gas pedal, and ultimately turn into a cancer. So
that's amazing. Like, I'm like, my brain is spinning out of control with like how simply you just made that. Okay, thank you.
Yeah, right? Yeah.
Yes.
So what we want to do is, we know that you can divide with an error. Let's take away the things that we know cause errors, right? So the things that we know cause errors are carcinogens.
Yep.
So we know that smoking is a carcinogen. We know that exposure to different types of preservatives is carcinogenic. We know, so if you can avoid things that we know cause cancer. So we know that alcohol can cause cancer. So, there's been a lot of studies to say how much alcohol is safe, right?
Yep.
So, healthy amounts of alcohol, no smoking, no doing drugs that we know cause cancer. And then avoiding preservatives as you can in your diet. So striving for whole foods, whether that's lean fishes and lean meats, whether that's predominantly vegetable-based diet, but just trying to have whole foods be the component of what we eat. We all are going to have cabin weekends and eat foods with preservatives. Right?
I love it. Cabin weekends. That's awesome.
Everything in moderation,
Right.
But doing the best you can to eat whole foods, a wide variety, fruits and vegetables, all of that, maintaining a healthy BMI. We know that extra adipose tissue secretes additional hormone. So maintaining a healthy BMI decreases your lifetime risk for developing breast cancer. I hate the statistic so much because it makes me a hypocrite, but I'm going to say it anyhow. So 30 minutes of sustained cardiovascular exercise 3 to 5 days per week will decrease your lifetime risk for developing cancer by 30%.
Wow.
Which is a huge number,
That's
right?
30%.
Yeah.
That's a lot.
That's a huge number. So,
Right.
and that isn't running marathons, and
No.
it isn't,
Right.
30
it's just
minutes.
a 30-minute
Walk?
walk after dinner, right?
Yeah.
Like
3 to 5 days a
30-minute
week. Okay.
like easy. That one is something that we should all be able to do. But that, that has been shown to help decrease your lifetime risk for developing breast cancer. So those are all like really kind of simple things that you can do to help decrease.
Oh, for sure.
And
Those are just like
Lifestyle.
Yeah.
Yeah. And
Yeah.
not hard lifestyles, actually.
Mm-mm.
Yeah.
No. Makes me
Yeah.
gotta have a dog, 2 dogs, because I get out and I get that walk
That's
twice
right.
a day.
Yeah.
Right.
Plus, they've been shown that animals decrease your cortisol level, right?
Oh,
So,
jeez. Win-win.
Absolutely.
Except for hers.
Well, mine might
Sure.
increase my
She's
cortisol.
got a dog that's not nice.
I have a puppy who eats socks, and my cortisol level
Oh,
definitely goes
right
up.
Yes.
So maybe not.
But yeah, those simple, and I don't want to say simple. Those are clear lifestyle choices,
Yeah.
right? And I recognize they're not necessarily simple in our society, which is inundated with
But if
preservatives.
it's not
and
simple,
foods.
that's the problem.
Right.
Because we should not, because stress is a huge contributor. I've been under an extreme amount of stress for many years. And I feel like if I'm really sitting back and thinking some of the things on your list I was not doing accurately, full transparency, we've talked about it. But stress, how does that play a role in cancer as well, right?
Spikes your cortisol.
Yeah. And so like long-term stress spikes your cortisol, which then your body has to fight that off, like you were saying, versus fighting off these cells that are misbehaving.
Mm-hmm.
And instead of capturing the misbehaving cells and being like, bad, you go,
Mm-hmm.
it has to deal with the cortisol. So if we don't have room in our lives for walk, if we don't have room in our lives for eating correctly and, not using substances, I mean, we got to look at this, right? We got to
There's
look
something
at
else going
this
wrong.
stress.
Yep.
We got to de-stress.
Mhm.
Like what's going on here? I mean, yes, I could preach about this all day. We need to
Well,
de-stress because
and
this is how I feel right now. I
You've
feel like
used this.
healing. Yes. I feel like healing has to be in like a stress-free, joy-filled, fun environment, or you're just not going to be able to get out of it. You can't take a depressed state and heal.
Mm-hmm.
When you identified at your diagnosis, wait a minute, I have been in a toxic environment.
It's exactly the word I was thinking.
And not just toxic chemically, but
Yeah.
emotionally.
Yeah.
Like you
A lot of
suddenly
ways.
realized there were so many areas of toxicity in your life that
Mhm.
had led to this.
And I do this for a living.
I know, right?
So, I mean, people who aren't self-reflective, not that they're not self-reflective, but they don't do it for a living. I mean, we all
can
need to
happen to
take a
anyone.
pause and do like an assessment on our stress and our lifestyle. If, nothing
Mhm.
else, but I'll get
and
off
you've
my...
you've used this to
Yes.
totally change your
Yes.
lifestyle, to
Yes.
eliminate those stressors,
Take the
those
toxins out.
toxins.
Not only the cancer, but all the other toxins.
Yeah, and
Mhm.
you've been walking that walk, and it's part of your healing journey, and hopefully keeps more cancer from returning.
That's right.
And is that? I mean, do you see that the lifestyle changes adopted after something
diagnosis?
Monique's been
Mhm.
through will help it from reoccurring?
Absolutely. These are
Okay.
all really simple things that you can do to help decrease your risk of recurrence. I also like to say cancer sometimes does what cancer does.
Yeah.
And
Yep.
it isn't your fault. It's not that you
I love that.
didn't,
Mm.
I ate an entire pan of chocolate chip cookies. It is not, none of it is your fault either.
No.
These
Yeah.
are options for how you can take some control.
Yep.
And how you can, decrease your risk. But cancer sometimes does what cancer does.
Yep.
And never should I would I want anybody to feel like you didn't do something correctly or you did something wrong that put you in the line of this fire.
Because like you do feel that way.
Yeah.
I totally did. Like, oh, I did this thing. I smoked this cigarette and then I, ate these preservatives. Look at me. I deserve it. But you can't help but feel that way with someone who has that diagnosis.
Yep.
So I appreciate you saying that because you're right. You can be perfect and still have this diagnosis.
You can have negative genes. You can have done everything right. And I see those patients too who exercise every day. They've never eaten anything other than homemade in their life. Like I see those patients and we don't know why that happens. Cancer does what cancer does sometimes,
Yeah. Interesting.
So it's also not your fault. And then the other thing I was going to say too, I think it's so intimidating. This is outside my area of expertise, but when I had really little kids and a busy career and all the things, and I was like, how am I going to get my 30-minute walk in? How am I going to do this?
Yes.
You don't have to change all the things.
Right.
Like you just have to do 1% better that day. You just have to do
I love that.
just one little thing,
yes.
That like, you're like, I did that today. I'm happy that I made it. I went once around the block. I did it. I did something,
right.
Yeah.
That self-worth too, that inner narrative is a huge part of our stress cycle as well. Yeah. We've talked about this in our burnout series, but sometimes like if your ambition gets in the way of actually how you're able to actually do it and your ambition's like, well, you should be better, you should do better. That's actually creating more stress and cortisol as well. So that's something I've been working on as well is like being realistic here. Like, hey, you got a lot going on. Some of the balls are going to drop.
Being hard on yourself for not living up to all of those things that you could be doing is actually countering doing those things.
Yes,
totally.
Right.
Yes,
So
yes.
it's like the balance of it all, the harmony of it all, which we also talk about. It's our constant pursuit of what is that right balance, but coming back to getting yourself into a place of joy, in a place of calm.
Yeah.
And what are the things that facilitate that?
Yes.
Before it's just a way to live, but then also through your healing journey.
For
just
sure.
remembering that. What makes you laugh? What makes, talk about ways to decrease cortisol,
Absolutely.
right?
Absolutely.
Spending time with loved ones, your girlfriends, the people that light you up and finding things that bring you joy and how to laugh. The shifts that can happen through that, can defy medicine, right?
Yep. One of my partners says this the very best. When you hear that cancer word, when it's in your name, it precedes it, right? Like when you hear that cancer word in your life, everything sort of stops. And I think one of the things that's so important is to load your bench, right? To pick your team, to whatever sports analogy that you want to say, but surround yourself with the people that you know will make this journey easier for you, that will have your back, have your support, surround you and carry you as you go through this. And I think that is your medical team, your friends. You're going to pick the people that will really truly carry you through this. And we do the same as providers, right? Taking care of cancer patients. I have incredible girlfriends that I sometimes golf with, right? I have incredible girlfriends that are people that I go to talk through cases with. I have other surgeons that are incredibly supportive that you can do that with. And I pick my team too, right? And surround myself with my team too. And that's a huge part of one of the things that you can do as you wait for all these answers, as you wait for knowing what your pathway is going to look like and what this is going to entail and what you're going to have to do. The first thing that you can kind of do is load your bench.
That is like the perfect segue or just bridge into one of the things that I recognized from Monique early on when she was very secretive about it, very few, she didn't want to tell anybody. And I remember thinking, but you have the best bench, right? I was like, you have the best women, friends, like people will be there for you. They want to be able to support you. And it took a little bit of tough love to say that to you and say, you have to tell people. You have to tell your children. You need to tell your best friends.
Right.
Because they can be there to support you. And then a really funny story happened that, do you want to share?
Which one?
About your best girlfriends finding Dr. Witt on the golf course.
Actually, I think she should share that.
She should share this.
You should share because
Monique's bench is fiercely like protective. And I knew as soon as these women know like they need to be out there supporting her, there'll be no doubt about it.
Yeah. She's got a very deep bench.
So lucky.
And I was in, wearing my other hat of just being, with girlfriends and having some fun, and we golf. We get together and make it through a few holes and then go in for a meal and just get to kind of decompress and chat. And we're there. I don't know all the rules of golf. I'm not an expert by any stretch of the imagination, and we're giggling and having fun, and we have music, and all of a sudden I see out of nowhere this like cart coming beeline across multiple other greens and everything else. And I'm like, we have done something wrong. We are not supposed to have music. There is something that we've definitely done wrong. And it was just somebody from Monique's bench wanting to be like, hey, are you Dr. Witt? You need to take amazing care of my friend. And I'm like, I will, I promise.
It's the best story. And you told me this right before my surgery, which was so kind, but I don't remember it.
That's okay. That's a good anesthesia.
Yes. Okay.
Yeah. No, I just wanted you to know how loved you were, so on the day of surgery.
Yes, that's the sweetest thing. Like that's the level of care you give.
Mm-hmm.
You tell people all the things that are positive and bright and sunny. Like, look at the rainbows in the universe. Because honestly, that makes a huge difference. Your care and your care team, huge difference.
Thank you.
Yes.
Well, thank you so much for joining us here today. I think that the gift that you are to the world is incredible, and that we can share it to anybody listening or watching our podcast. I feel so grateful as one of Monique's bench members that I knew she was in great hands before I even met you, just from the way that she spoke about you. And I just couldn't thank you more for your care of her and for all of your patients.
Yes.
Like, it's incredible.
It's the greatest honor of my life.
Oh,
yeah.
Thank you for being on, and for all your work.
Absolutely.
You're an amazing. We will get her contact information.
Everything, yes.
In the show notes.
Everything will be linked on how to find Dr. Witt and the many resources that she shared with us today.
Mm-hmm.
And stay tuned, because we need to have a party. We need to have
Yes, our risk factor. What did you call it?
Party.
Yeah, girlfriend party. Yeah,
girlfriend party.
Calculate your risk.
Calculate our risk.
Okay, I really see something.
Do the
coming
best for
together.
your breast. Something like that.
I like that. Oh.
Do the best for your breast with your besties. Even so many ideas. Stay tuned. There's something coming here. I love it. We'll capitalize on our networks and how we can really help bring people together for this cause.
Awesome.
Right.
Invite me. I'll come.
Okay.
I love that.
Awesome.
Cheers, friends. You've just finished another episode of the Heart and Soul podcast. We hope that you've enjoyed the show, and if you've loved it, we would love if you'd leave us a 5-star review on whatever platform you're listening. You can find links to leave that review in the show notes, where you'll also find other resources that we reference on our show. And if you think a friend could find value in today's episode or any future episodes, please share this episode with them on social media. This is one of the only ways the podcast can organically grow, and we just can't wait to connect with you and all of your besties. You can also find Monique and I on our many social media platforms or our websites, and we're going to leave links to those in the show notes as well. Thank you for listening. We look forward to sharing our hearts and souls with you again next time. With Heart, I'm Mariah.
And with Soul, I'm Monique.